but duration is 4 to 6 typically. So with that time, that 4 to 6 hours, when you're having two individuals sitting with the participant, it really can bring down costs. It can bring down with the cost of it, but it can also make it so it's easier for individuals that can't dedicate a whole 12 hours to going on this potential trip. The nice thing where I'm kind of biased with psilocybin specifically is access. You spend 5 minutes walking around at these different booths and you'll see that access to psilocybin is quite easy. People can grow it on their own. And as they do that, and they grow it in a group setting with a number of people, it can be very, very accessible as opposed to having to go through and access through other means, such as, with MDMA and substances like that, which is a little more challenging to get. Anyone can end up accessing it. I have a friend who, when I was in school during COVID and everything was shut down, she did not have any access to her SSRI medication that she knew that she would be able, that would help her as her depression came on. She was a nurse working the front lines. So she was able to go out and procure psilocybin during that time and found great treatment for her in microdosing, which is going to be a topic I'm going to talk about more later this afternoon. What we find with psilocybin, the treatment with high-dose psilocybin going on that 4 to 6 hour journey, 83% of participants in studies have shown that they had a complete remission of depressive symptoms. Their depression went down to not being there anymore, compared to 14% in the control study. What they also found with the use of psilocybin was 58% remission of anxiety symptoms. And in 6 months, when they did a follow-up, what they found was the antidepressant effect still lasted and maintained for 60 to 80% of the individuals. 52% of the people who partook in the psilocybin journey, 52% said that it was the singular most important experience in their life, compared to childbirth, being married, a death of a parent. This one substance that they ingested at one time was comparable to those major life events. And 87% of the participants reported increased life satisfaction that they attributed to that mystical experience, that inward journey that they had experienced just from the ingestion of that substance. Now, where I think it's going to be very exciting to see as this goes on is individuals who might be at end of life, cancer. When we start looking at treatment and access with that, standard medications often don't work as well. Treating end-of-life distress is incredibly difficult. I try to do it every day as I'm prescribing antidepressant medications, and about 40% of individuals have a response with standard medications, because it's different when we start looking at that, when we have existential dread, what's happening when I die, what's happening to my family, what's going on the other side. So if we can end up using these substances where someone dies before they die, and they're more present. I was talking with Tony Bossis, who was at the NYU doing the end-of-life studies, and he was telling me that he had an individual he'd been working with for a year. That individual did 2 or 3 psychedelic journeys, and when they did the follow-up afterward, he met with him, and as he was talking to him, he knew that he did not look well. He knew that this gentleman was dying and knocking on death's door. And when he met with him, the patient looked at Tony and said, "Tony, you look a little upset. I know I'm dying. You're going to be okay." And Tony just kind of took a step back and he realized this person's dying within weeks possibly, and he's reassuring me that I'm going to be okay. We don't see that. There's no medicines out there that can have that type of an effect. Incidentally, about 3 days later, that individual did pass And his family was very appreciative because during that time in his life, he was able to be present with his family as he was going through his death journey, and being able to spend time with them, not worried about what's going to happen when I'm gone. So I mentioned this mystical experience. Researchers found that the ingestion of large dose individuals had improvements in their attitudes in life, attitudes in self, a positive change in their mood, positive social effect, increased spirituality, and improved well-being and life satisfaction. And we start seeing that mystical experience, that quantum change that comes with it. We see this spontaneously happen. It might be like a mystical experience that someone has that they by chance come across. Having a religious experience can be done with breath work, near-death experience such as a car accident, things like that, or someone having an epiphany, which is very difficult. Some people never have those type of experiences, or they can ingest this little bit of this mushroom that can bring that on and have that control coming forward with it. And as I mentioned, those experiences and having that change that occurs, they've seen these changes lasting for at least 14 months afterward. And talking with the researchers, they've seen it even longer. They just have not published those studies yet. Now, about 3 years ago now, there was a study that came out that was a head-to-head trial of psilocybin compared to escitalopram, which is Lexapro. And with that trial, what they found is, if you read just the beginning, the abstract that's there, they'll say that individuals where they had this experience and they went in, the psilocybin was no better when compared to standard medications. But when you dig into it, what we found was that people had the psilocybin group had much better improvements, and their side effects were much less. So the antidepressant, the escitalopram group, what they reported is with starting the medication, they had increased anxiety, side effects such as dry mouth, sexual side effects, have a blunting of their mood and their emotion, as compared to the psilocybin group that reported having an improved ability to cry, having more feelings of compassion, more emotion, feeling more pleasant, and less drowsy. So when you compare, I mean, I don't think that there's even much of a comparison between the two, when, yes, they both have someone on the grand scheme feeling better, quote unquote. But if someone has, more anxiety and more side effects and not feeling emotion as opposed to feeling emotion, experiencing emotion as it really is, I think it's kind of a no-brainer on where the difference is. So how do these substances work? What common thing that you probably have heard of is what's referred to as turning off the default mode network. It changes, it has more connections. The blood starts flowing in different ways within the brain, and the parts of the brain that don't typically communicate with one another start talking. Typically, I usually have a slide here showing these connections that are there, easily to find online. But what we see with it is, in changing that default mode network, it ends up turning down those other parts of the brain that are task negative. And this is the parts of the brain that light up that default mode, that are typically activated during daydreaming, people having self-reflecting, meditation, and just kind of when the mind is not fully engaged and active. So when we start seeing those changes, that improvement is just huge. Now for safety, when we start wanting to look at safety with this, I think the big thing to look at is two terms called set and setting. clinical research typically will talk about how it's superior and how it's unsafe to use these in the naturalistic environment, or as I like to refer to as the wild. But by improving the set and setting, we can do that on our own without being inside of a medical clinical setting. The set is the subject's experience, their motivation, their intention. So having an idea of what is it that I'm hoping to gain from having this experience. It includes oh nice, the generator's off. Yeah. That's nice. It also includes the person that's sitting, the sitter that's with them. What is their experience with the medicine? What are they expecting to kind of going on? And having a agreed upon procedure, having a preparation and talking about what to kind of expect, what to kind of see going on in there, and having that little bit of a guidance. So when the individual is able to let go, they can actually let go knowing that the individuals that are sitting with them are going to maintain that their safety is there. And then the setting is the actual physical environment, the interpersonal connection with the people that are sitting with them and the circumstances that the drug is administered. So typically, they follow what is referred to as like the Hopkins protocol. It's usually 2 individuals, it's in a comfortable room, headphones, blindfold, and the individual is encouraged to kind of go inward and see what the experience is going on, to kind of come back out and talk about what they experienced while they're in there. So these are things that could be very easily obtained at home, very, very inexpensive with the headphones and blindfold. That is when someone is doing the eye mask and going inward. It's typically at a higher dose where there's more of a psychedelic experience going on, as opposed to a low dose. So in the low dose, people are having more of the barriers that are there, that emotional response that comes up typically is shut down, so that people can do like talk therapy. It's referred to as a psycholytic dose, as opposed to that fully psychedelic dose. So typically the people that are sitting there are not really interacting, they're just maintaining safety, checking on the individual, making sure that they're comfortable with what they're doing and how they're going inward. And if something comes up, if they might have to use the restroom, need tissues, kind of just remembering things that are going on, kind of keeping notes, things like that. So I keep using this term mystical experience. What is a mystical experience? There's a couple of factors, there's a couple of things that people talk about. First factor is mystical, that being a feeling of internal unity, external unity, like feeling a connection with people around you, this oneness, this awareness, awesomeness. There's a noetic quality, the feeling that the things that you're learning and the insight gained is an intuitive level. You're having an encounter with the ultimate reality, and knowing what you saw is real. And if someone has never experienced these substances, I know this sounds like absolute crazy talk, but to anyone who has taken these experiences, they'd be probably nodding their head going, I know exactly what you're saying. And there's a feeling of sacredness, feeling there's increased spiritual awareness, a sense of reverence, and feeling that this is a sacred or holy experience. Factor 2 is a positive mood, having an experience of amazement, a feeling of tenderness, peace, tranquility, awe, joy. Third factor is a transcendence of time and space, a loss of time, loss of space, feeling this awareness of where you are, and a sense that you're outside of time sometimes, and that there's no boundaries within space, this timeless feeling. And the last factor, which I think is the most exciting one, is ineffability. The ineffability is the sense that the experience cannot be described in words, and doing so will not give it any justice. And feeling that it's very difficult to explain what does that exactly mean, to individuals who have never experienced these types of medicines. So typically in a psychedelic experience, there's 3 phases. There's an early preparation where you start talking to the individual of what are you looking to do, what are you looking to gain. Might be looking at like what medications they're on. I typically get asked to come in and consult with potential drug-on-drug interactions, things that might not necessarily be unsafe, but might block the effect from being as deep as it is. The second phase is the psychedelic session, where someone goes in, they start to take the medicine and go inward. And then the last phase is the post-integration sessions, where they start talking with individuals. It might be the people that you sat with, it might be a outside personal therapist, it could be a friend, it could be with yourself even, and with journaling and kind of exploring, what did I just experience and what am I gonna do with this? What am I gonna gain, what am I gonna do to make these changes from this insight that I gained from using these substances? This is the part that I think that is probably the most important out of all of them, because afterward, to actually make these changes that are occurring and making them stick, this is where the rubber meets the road, and making those changes and going forward. So sometimes someone might have a plan going in the pre-sessions that I want to do X, Y, Z, and completely it changed from the experience and learning different insights. I do recommend that when someone does have an experience and going in, they don't make any major life changes in days and weeks post. That way it's not something that's kind of spontaneous, out of nowhere, rash decisions. And kind of being able to look at it and go, I'm going to do this now, and explore that. But it should be done taking time to not let the medicine blind them from what might be a great thing. As I said, that I am kind of biased where I feel that nursing kind of comes in here, is we are nurses are the largest group out there for healthcare providers. We have education, the ability to sit and be with someone. I feel that if you can sit there like in a CCU or work with someone who is completely delirious or psychotic, or even just needing someone to talk to, that's where nursing is perfectly fit, because those are things that we do. The only difference is we're inducing these types of things by the ingestion of this substance. There are some considerations to think about, though, when we start looking at psychedelics. One of the biggest ones is legality. Unfortunately, they're not medically accepted at this point. So procuring and using these substances are illegal as of right now. Probably the biggest side effect that someone could have, other than having a negative experience, is potentially having legal consequences. Last year, 2 years ago, I testified before a court in Indiana for a friend of mine who was caught microdosing, and she ended up getting charges for felony distribution because of the amount that she had. Luckily, between her lawyers and a team of professionals that came out and spoke for her, she ended up getting it reduced down to a misdemeanor, and she just actually got that expunged as well. She's going to be able to maintain her nursing license, but for that 2 years, it was absolute hell for her to have to deal with that, not knowing what's going to happen with this. So I think that there is a chance that those things can happen. And I think that we need to come forward and start making our voice known, that we want to see these substances become legalized, and including decriminalized. Because even when they become FDA approved at some point, there's still going to be problems with access for individuals that might not have the insurance to be able to cover it, not feel comfortable going into standard health settings to do it. And the underground is going to be continuing. I think that when we start having individuals like today, where we start talking with veterans, it might be a little bit easier for a vet to go in with other veterans and have some of these experiences, as opposed to going into a medical setting. They want to be around individuals that know what they've gone through and how they've experienced life. And I think that we need to kind of move forward and really make sure that these things are obtainable and people can have these life-changing experiences. And I think we need to start normalizing our language, advocating for increased access. I know this year when we looked at the movement for the psilocybin legalization here in Maine, the first go around that we did, we had a lot of challenges through DHHS, but the conversation was completely different when we went through the Veterans Committee this year. And I think that we need to, use our voice to be able to make this something that we want to see and let people know that we're sick of waiting for the change to happen, because the medicine is out there. The medicine's waiting for us to be able to use them. I mean, I believe that that's why they're here, and I think that we need to change that narrative and make our voice heard, that we want to be able to access these medicines. This is kind of like the end of what I've got to say at the moment. I'm going to be talking this afternoon about microdosing, but I am going to be up here for a couple minutes. If people have any questions, please. Thank you.
You're welcome.
Thank you.